To National Women's Health Week now. It's a time to empower women to take charge of their well-being. And this morning, joining us is Dr. Sonia Hassan from Wayne State University to talk about the biggest health priorities, where we're making progress, and what exactly still needs attention. Dr. Hassan, we appreciate your time. So tell us about the goal of National Women's Health Week and why it's so important for women to really pay attention here.
Yeah, thanks so much for having me. Well, National Women's Health Week starts every year right at Mother's Day. This year it's from May 11th through 17th. Really, the idea is to raise awareness for women's health issues, to encourage prevention, to encourage moms and babies and women of all ages to get themselves health checkups and to really maximize their lifespan.
Yeah, you're talking about get that checkup, right? So what are some of the key screenings or maybe checkups that women should be making time for, especially for those that might be skipping some of those doctor's appointments?
Yes, I know we all do it. It is important to remember there are some big things with women. First of all, I want to say that number one, cardiovascular disease. It's the number one killer of women. It is something that people don't realize. Over half of women don't realize that that is a threat to our health. And you really need to get your checkup as soon as possible. What it is you get your cholesterol checked, your blood pressure checked. You want to make sure you're eating healthy, have a very healthy lifestyle, but really get yourself in for the prevention area first, so to prevent things later in life. In addition, you want to look for cancer prevention. So breast cancer is 1 in 8 women will have that disease, and it is the most common cause of cancer in women. So you want to get your mammography starting at age 40 or 45 to talk to your provider and do that on a regular basis because it is preventable, and it also, if it's caught early, it can be treated very, very, very well. The same with colon cancer. You want to get your colonoscopy starting at age 50 and to get it as described by your physician as well. And then another one is skin cancer. People don't realize that that overall is one of the leading causes of cancer in all people. And so remember to wear your sunscreen, wear protective clothing, but also, which we all do not do enough, is to get that yearly exam of your skin by a physician that's qualified to look at those things. And so that's just some of the health issues. You want to talk about health, you want to also include the idea of mental health. Don't forget that that is part of our health care. And really, really important because women experience depression much higher levels than men do. And often it's not recognized because people are busy in their lives. And it's something you want to recognize for symptoms and go into your provider and get the support that you certainly can get.
Yeah, it's important to include mental health in that conversation too.
Absolutely, something that's often overlooked. Now, are there specific age milestones when women should be paying closer attention to certain health concerns?
Yes, certainly. So you want to, of course, even if you're younger, even if you're in your teens, if you're a younger teenager or 20s, you want to still get into your healthcare because there are specific things that, like, for example, some vaccines that are very helpful in preventing cancer later in your life, the HPV vaccine, for example, but also other things that you want to talk about early and to cause prevention. Then once you get obviously into your pregnancy years, your prenatal care is most important, and that will help you through your lifetime because whatever happens during pregnancy does affect your health later in life. So that's an important thing to remember. And then when you get into your 40s, you want to start getting screenings, as I said, for mammography, continue to get your pap smears because that is a very screening mechanism to prevent cervical cancer, of course. And then when you get into your 50s, you will start looking at colonoscopy and other cancer screenings as well. If you are a smoker, it's also very important to talk about that with your doctor because lung cancer is also a very high cause of cancer in men and women. So that is something to talk about as well.
So you work with women all across Michigan, your department does there. Do you guys see disparities in women's healthcare access? And if so, where do you guys try to address those and break down the barriers?
We do. So we do see a lot of disparities with regards to healthcare access really throughout the state. And it's both in urban settings, but also in rural settings. And the one thing that we would do a lot of work on is in pregnancy, because we are seeing higher rates of maternal and infant mortality. Although we're making some strides in the state, our rates of maternal and infant mortality in the state are higher than the national average. And so if you think about it, the number one cause of infant mortality is preterm deliveries. And one of the leading causes of maternal mortality is blood pressure or high blood pressure in pregnancy. And so those two things we think are important to tackle as we look for treatments to bring that rate down. And so what our hospital systems are doing with us is our Office of Women's Health has put together a coalition of leading healthcare systems and universities across the state to address this issue. And what we find is that you have issues with regards to, as you mentioned, access, but also getting the best evidence-based treatments, and also just getting each patient to where the site that they need to get to. This is true in urban settings where you have access to care issues with transportation, but also in rural settings as well, when there's maternity deserts all across the state. And so what we have tried to do with this network is do three really main things. Is number one, make sure that everyone enrolled in this program, which I should say is called SOS Maternity Network, are really getting the best medical care and treatments and tests that they should get throughout their pregnancy. They should get all the transportation that they might need throughout their pregnancy is paid for. And also the third thing is a person or patient navigator at that site that will help them gain access to navigate really the healthcare system that's very, very complicated, as we all know.
Yeah, and so you're talking about the SOS Maternal Network, right?
Yes.
Okay, perfect. Yeah, that's what I thought you were talking about. You started to go down that path, and I'm like, I think that's what I'm hearing there, which is a very important resource, which also works here locally as well with Corewell Health and Trinity Health as well.
Absolutely, and it can be so nerve-wracking sometimes, I think, when it comes to maternal health care, because there's so many appointments. It's so costly, not only just to have a child, but then to go through the process of getting to that. What would you say to moms that are feeling in fear of just showing up to the doctor because of that, expense on their wallet?
Yes, no, it's exactly right. There's a lot of fear of getting the care you need, but also the access and how will I pay for it, but also how will I get the transportation and other things. I would say that don't be afraid of going in, because that's the most important thing you can do for your pregnancy is to see your doctor or your provider to be sure that you're on the right track. They can help you get hooked up with the appropriate insurance, whether it's Medicaid or other things. And then also there are programs like this that we're talking about that can provide transportation if that's something that's needed to help with access. But also they look into the idea of resources too. We work with them to see, do you need food? Do you need housing? Do you need utilities? Do you need help with navigating just the pharmacy experience? So as you all know, healthcare is a complicated thing. And for even those of us in healthcare, it becomes navigating issue is a big problem. So the most we can do is give the most help we can to all these moms.
So back to that network, how did that network start? And, was there a key issue you guys were seeing that you guys said, hey, we need to start something for these mothers and these newborns here to help make sure that they survive?
Yes, we started thinking about the biggest problems in our pregnancy world is as I mentioned, maternal and infant mortality. And we know that there are tests and treatments that exist that can prevent both of those things. So, and you will be amazed to know that in many cases, women are not getting those tests and treatments. And that really happens for a number of reasons that relate to access, that relate to their ability to get to their appointment, that may relate to their insurance, it may relate to that facility and how it's set up. And there are just a number of roadblocks that prevent people from getting it. And so we got together as all 14 large health systems and universities within the state and said, together we're going to do this, put together a pregnancy care bundle that optimizes the care for all these women and agree to do it together. And it was very unique because usually these systems would be competing, but for this issue, they said we are going to do this together, and it's been very, very exciting as it's been spread around the state, and we hope to continue to do that in the future.
Let's talk about the conversation around cardiovascular health in women. That was something you touched on just a few minutes ago as being something important to keep tabs on as you continue your life here as a woman. Can you talk about what the most important areas of cardiovascular health women need to focus on? Where does this all play into the conversation here?
Yes, as I mentioned, it's the be killer of women, and it is often called the silent killer because women have different symptoms of heart disease than men do. Certainly, if you're going to be having a heart attack, you're going to have a chest pain, you're going to have sometimes discomfort, though it may not be a crushing chest pain. They might be short of breath, they might be just a fatigue a little bit and just out of the ordinary. So anything that feels different to you, please get it evaluated. But again, the prevention is the best medicine, and we would love for people to get in early. Really, as I mentioned, as early as during your pregnancy, but also after you're in the 40s or above. Get your blood pressure checked, get your cholesterol checked, even if they're normal, just for a baseline. To think about lifestyle issues, so getting plenty of exercise, getting the healthy foods that we know can make a difference, because inflammation plays a lot into people's development of heart disease. And then really, really think about stress reduction as well. So these are all things I know that we know everybody daily, but we don't take the effort to do it. And really want to just urge people this week to think about it and think about one or two changes in your life that you can do to make, go down that path. I think it will make you feel much better and hopefully prevent something in the future.
Yeah.
Yeah, and women, of course, often juggling so much, work, family, caregiving. How important is it to include mental health in the conversation of women's health?
Yeah, so it's a great question. Because everything that we do, all of the things that you're juggling as women, the stress builds up, and often you're sort of putting it aside so that you can do the things that are in front of you. But that does play a role in long-term health, and cardiovascular disease certainly is one of them. But as I mentioned, stress brings on the idea of inflammation. It brings on other issues that will progressively go into all parts of your body. And so the more you can do, start out with taking 5-10 minutes a day and do meditation or do relaxation or working out for yourself, that will be better for you and your family as well.
If someone is watching this, let's say we have somebody at home listening to this interview and they haven't seen a doctor in a while, where might be a good place to start? How can they start down that path to go and get that first checkup that they need if they haven't had one in a while?
Yeah, so great question. Just, pick up the phone, search the internet for a location near you, and that can be a generalist, internal medicine. Of course, if you have an OBGYN, they can certainly do that, a family medicine person, other nurse practitioners as well. So anyone in general medicine as a screening test, a screening visit is very, very important to start with. And then from there, they will probably refer you out to what might be needed. But please do that today.
All right, Dr. Hassan with Wayne State, we appreciate your time. Thank you so much for carving some time out for us and talking about this very important subject there. We appreciate it.
Thank you for having me.